Hi, my name is Kaylee Mooring, and I did this project on a 70-year-old Caucasian male who worked as a lineman and electrician. He is married with 2 children. He states he is the primary caregiver and the provider for his family. He also lives in a rural area. Transportation is an issue for him due to his age and the area he lives at. The client stated he is fine with a male or female provider and comes from a polite background. However, becomes uncomfortable with excessive touching from individuals he does not know. He also states that he is in good health due to him taking his medications. However, the client states for a home remedy he uses bourbon and tequila to kill a cold. He also states he promotes his good health by walking. He also wants to be the one who makes the primary decisions for his health. The client's environmental control is internal because he feels like he can environmentally control the things going on around him and make his own decisions. He is time-oriented and presents well and sleeps, according to him, is going very well. He uses glasses and does not have any assistive devices for mobility. His gait was steady. The only current medical condition he has is CHF. His past medical history is an MI back in 2000s, which he had a cath done for. He is currently on 80 milligrams of aspirin and 40 milligrams of Lasix, which he takes when he eats. A topic discussed with him is his access to primary care. It is a contribution to his follow-up appointments with the doctors, along with taking his medications on his correct schedule and the prescription for his glasses. The education of the people who cannot get the medical care that they need related to the access to the health care is evidenced by the rural areas. This patient, for a short-term outcome that we discussed, was making it to all of his appointments that month for his primary care, which, while talking to the client, I recommended him writing all of his appointments on a calendar and have it in the kitchen where he is able to be seen. Signing up for the reminder phone calls from the office to remind you, I believe, a day or two before, if not a week before. And then asking family to possibly be his driver to help him make it to his appointments on time. The client had agreed to adding a calendar into the kitchen and adding the dates to his calendar so it would be easily be seen. He also agreed to signing up for the phone call for his appointments to be able to get the reminders. The only thing he did not agree to is wanting to contribute to his independence is driving himself to his appointments. He was able to make it to all of his follow-up appointments last month. A long-term goal for him would be following up for his primary care and taking his medications properly for the 6 months. So one of the ways his medications could be taken properly, we talked about possibly having a pill organizer for him so he could see his medication and know if he took it Sunday through Saturday, if he took it on each day, and also have it in a scene in an area that he usually goes to for a drink. So possibly a coffee maker right beside his coffee maker in the morning, so when he makes his coffee, he can take his pills right then and there, and it will keep him on track. Another way we also discussed with him was having almost like a chart where he could write down, it would have the pill, and if he took it in the morning, the afternoon, or the evening, and what day it was, so he would be able to see each time in case it was at a different time in the day. He agreed to go and purchase the pill organizer. This is economically stable for him because pill organizer costs maybe $2 to $3 at a max. So this would be easy for him, and economically it would not cost you a lot of money. He also still agreed to write down on the calendar per his dates and signing up for the reminder calls. This economically would probably be the cheapest for him if he was worried about money. It's easy for education because it's very accessible. Even if you are not your education level, it would be at least a high schooler, which he is above because he was in the trade school. And between having to possibly even purchase a calendar and purchase a pill organizer, it would be underneath $20, which would save him money. And then also the phone calls would be free for the doctor's office because majority of doctor's offices do the reminder either on a paper or on the phone calls for him. So far he has succeeded in his short-term goal, For his long-term goal, it would be for the next 6 months with taking his medications and following up with his primary care. So we will see. So far, he has made good progress. It is currently month 2, and he has not missed any of his appointments and has been taking his medications properly. Thank you.